What is thiamine? Thiamine is the first B vitamin to be identified, hence the name vitamin B1. Vitamin B1 is necessary for energy production, nerve health, and for the maintenance of mental function, including concentration and memory. In addition, thiamine has antioxidant capacity and may also have a mild diuretic effect. Vitamin B1 is destroyed during the cooking of food. In addition, vitamin B1 levels in the body are depleted by high intake of carbohydrates, especially sugar, as well as by the consumption of alcohol, nicotine, and tannins, present in tea and coffee. Thiamine is found in muscles, liver, heart, kidneys, and brain and is important for almost all cellular reactions. It is necessary for energy production, as it helps break down carbohydrates and fats. It also helps form ATP. One of its most important functions for health is its involvement in the nervous system. The vitamin is needed to produce acetylcholine, a chemical messenger vital for memory, as well as to maintain muscle tone. It is also necessary for the production of hydrochloric acid present in gastric juices, is necessary for the health of muscle tissue, cardiovascular function, and is involved in different functions related to circulation and blood production. Vitamin B1 deficiency produces a pathology called beriberi, although nowadays in developed countries it is rare since white flour, bread, and cereals, foods that most people consume on a daily basis, have been fortified with thiamine. However, there are groups of people who are still at risk of suffering deficiencies, such as people who do intense exercise, people who suffer a high level of stress, adolescents, and people who consume very caloric and not very nutritious foods, also called empty calories, people who consume diets very high in carbohydrates, elderly people, and especially alcoholics. Thiamine deficiency has also been linked to fatigue, weakness, nervousness, irritability, depression, cognitive dysfunction, muscle spasms, stress, type 2 diabetes mellitus, hair loss, cardiovascular disease, gastrointestinal disorders, neurasthenia, fever, infections, wounds, injuries, and headaches. Vitamin B1 is found in whole grains, oats, nuts, brewer's yeast, meat, poultry, and fish. What is thiamine for? The consumption of vitamin B1 is intended to cover the needs of this vitamin and to prevent deficiencies. It is also used as an aid in the treatment of some of the conditions mentioned above. The consumption of vitamin B1 together with other B vitamins can increase energy levels, alleviate post-exercise fatigue, improve reaction time and concentration. Thiamine can promote muscle development and recovery, relieve stress and muscle tension. Thiamine intake can increase energy and endurance, reduce exercise-induced fatigue, allowing proper energy metabolism. As thiamine has some antioxidant power, it is used by some experts to protect the body against aging, alcohol, and tobacco. A study conducted in Japan showed that 100 mg of thiamine can help regulate glycemia, blood glucose, and reduce fatigue after exercise. Other studies have shown that thiamine can help improve mental functioning, increase vitality, and improve reaction time. Because of thiamine's key role in nervous system function, energy production, and its effects on mental state, thiamine is often called the morale vitamin. Thiamine dosage. The recommended daily amount of thiamine, minimum amount to avoid deficiencies, for the Spanish population is 1.4 mg. The minimum amount usually used as supplementation is between 2 and 8 mg per day, although many experts recommend supplementing with 50 to 100 mg of thiamine per day. Another way to make thiamine recommendations as a dietary supplement is based on the amount of food consumed daily, recommending about 0.5 mg per 1,000 calories consumed. Like other B vitamins, it is advisable to consume thiamine in divided doses throughout the day as part of a B-complex supplement. Magnesium may help convert thiamine into its active form, and vitamin C appears to enhance its absorption. Precautions with thiamine. The consumption of thiamine is generally safe, as it is a fat-soluble vitamin. Its excess is eliminated in the urine. It should be taken into account that there are drugs that interact with thiamine. Some of them are antibiotics, sulfonamides, and oral contraceptives that decrease the levels of vitamin B1 in the body. Anticonvulsants, antacids, and diuretics can also reduce the absorption of thiamine, which can facilitate the appearance of deficiencies.